do you need longer consults to provide cognitive functional therapy?
Yes. So the short answer is yes. If you think about it, we're working within a biopsychosocial kind of model here. Unfortunately, physio has developed from, doing a treatment, like come in, give you a rub, crack your joint, out you go. Short, don't need time for that. Or it's developed from this idea of they come in, you give a few exercises and the person goes out the door. What we know is that for a person who's got a history of chronic and disabling pain, for example, there's a whole story that goes with that. And that story has to be heard. Patients explicitly say they want time. They want time to be heard, to be validated, to make sure that their concerns and preferences are taken, that they're heard by the clinician, to make sure that we're skilled in thoroughly examining them. We don't miss things, so we don't miss specific pathology, but also that we can thoroughly examine them to determine what's going on and where their functional barriers are, for example. But then they want to be educated. That takes time. It takes time to build trust. It takes time to sit down with someone to help them make sense of their pain, but also to give them a plan for recovery. You can't do that in 20 minutes, unfortunately. Now, if you're caught in a situation where within your clinical setting, you may only have 20 to 30 minutes, I would encourage you to break the session into 2 or 3 and to explain that to the patient. And very rarely will they be upset if they know that you've got their best interests at heart, that you want to get to the basis of what's going on and to really understand what's happening to them in their world and to map a path that is relevant to them, that will take them back to the things they value.